Cicu devices.
Cicu challenges. Under pressure. Impella Purge issue. A 63-year-old male with a history of arterial hypertension and chronic ischemic cardiomyopathy, who had previously suffered a large anterior myocardial infarction and had an ICD implanted due to severe systolic dysfunction. He was admitted to the emergency department with sudden onset dyspnea, orthopnea, and auscultatory findings consistent with acute pulmonary edema. On arrival, he was hypotensive, cold, clammy, and showed clear signs of systemic hypoperfusion. Immediate management included oxygen therapy, intravenous diuretics, and inotropic support, dobutamine followed by norepinephrine. Transthoracic echocardiography revealed severely depressed left ventricular function, with an ejection fraction less than 20% and anterior wall akinesia consistent with prior infarction. The patient was evaluated for heart transplantation due to advanced heart failure and hemodynamic instability despite medical therapy. Given the need for intermediate-term circulatory support, the heart team decided to implant an Impella 5.5 device via surgical access as a bridge to decision or transplant. The procedure was uneventful. Correct positioning of the device was confirmed intraoperatively with adequate initial flow parameters. The patient showed notable clinical improvement in the first 24 hours, with improved tissue perfusion, falling lactate levels, preserved diuresis, and gradual weaning off inotropes. The patient initiated passive mobilization and achieved early sitting position the next day. On day 4 of mechanical circulatory support, an alarm appeared on the Impella controller, prompting immediate evaluation by the clinical team. The patient was hemodynamically stable at the time, without new symptoms. Focus turned to the console's purge screen, where the following parameters were noted. What could be happening? A purge tubing kinking. When facing a low purge flow alarm, the following possibilities should be considered. A kinking of the purge line, or the possibility of thrombus or biomaterial buildup near the impeller gap. These issues can lead to a significant decrease in purge flow, which may ultimately result in pump stoppage. In the present case, the controller displayed the following findings on the purge screen: sudden spikes in purge pressure and simultaneous drops in purge flow. Although the issue resolved spontaneously, it recurred intermittently. Based on these findings, the suspected cause of the purge flow drop was a kink in the purge system at some point along the circuit. A thorough inspection of the purge system was carried out. However, no visible kinks or obstructions were identified at that moment. The tubing appeared completely intact, and all connectors were firmly secured. Despite this, the alarm reappeared whenever the patient shifted onto his left side, strongly suggesting a positional or dynamic component to the issue that had not been apparent during the static evaluation. Further evaluation revealed intermittent kinking at the connection between the yellow purge membrane and the tubing, triggered by pressure on the patient's left flank, specifically when he was lying in the left lateral decubitus position or leaning on his left side while seated in the chair. It is important to note that this clinical case occurred in 2023, at a time when the first-generation Impella 5.5 device was still in use. This version featured a long purge line that was susceptible to kinking at various points. The edges of the console door. The areas where tubing touches the floor and may be caught under wheels. The connection with the yellow purge valve. And at the purge sidearm. Fortunately, second-generation Impella 5.5 is now available. This new generation device features a shorter purge line, a more compact purge filter and reservoir system, and partial integration of the purge tubing within the white catheter cable. These modifications were specifically designed to minimize tubing length and reduce the risk of kinking, particularly during patient movement or repositioning. We invite you to watch this video, where we explain the characteristics of the second-generation Impella 5.5. The link can be found in the description.
If you've enjoyed our video, please press the like button and subscribe to support us so we can continue creating quality content like this.